our Health and Human Services meeting to order, and I'd like to begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Members, Legislator Elaine Daly here, Legislator Brian Madrow here, Legislator Bob Shea is here, Legislator Tom Winslow here. I am as well. So we have a full committee. First order of business is minutes to approve from our May 14th meeting.
I'll move them.
Second.
Any discussion or questions on the minutes? Hearing none, all in favor?
Aye.
Any opposed? Those pass. We have no appointments to consider, so we're going to go right into the department updates and our resolutions. I'm going to mix up the department updates a little bit according to who has resolutions or not. So Deborah, Dennis, is she not here? I didn't get an email or she does not have updates and she does not have resolutions. So I'm going to move along to Lauren Walsh.
Okay.
Unusual for you.
Yeah, that's probably just sort of. I did have a couple updates. We have officially switched over to our new EMR. That was, we don't recommend having to do that for a very long time because it's not really exciting and it's a lot of work. So we're still working out a lot of the kinks. It's going to probably take us quite some time to figure all that out, including the billing. So some of our billing, if you remember, is being outsourced through our EMR. They're doing some of our billing tasks with the future planning that our person in our billing department is going to graduate with their MSW eventually. So we kind of put that in place so that we can make sure that the billing gets done because obviously the revenue is really important to the department. So we kind of have a plan of how that's going to look, but we're kind of working out the kinks just to make sure we have a good system in place of what our responsibilities are for the billing on our end and what they're responsible for. So it's kind of a work in progress. Any questions on that?
I have one.
In your 2025 budget, there was only a budget for one position till June. Is that the position you're referring to? Or it was another position, assuming that we were going to have purchased your billing software and you may need less personnel?
So we had two people in our billing department.
Okay.
The supervising billing specialist and a billing specialist. The billing specialist was let go and we were not going to backfill that.
Okay, already.
Right now.
Okay.
Originally, the supervising billing specialist, I believe, is the position in the budget that was going to be cut because she's graduating.
Okay, that is
But we kept her in that position because we don't have anybody in the other billing specialist position. So I met with the personnel committee to talk about that.
Okay.
So we only have one person in the billing department as of now. And that person is the one that will graduate and we'd like to hire as a social worker.
And the intention is to keep it at that one person because of the EMR and how it integrated billing.
Correct.
Okay.
And we aren't certain what the position is going to be, either a billing specialist position or a senior clerk. They're a grade apart. We're just sort of figuring out if somebody needs that billing knowledge or not based on what our responsibilities are in that.
You have funding for the position. You just need to time it with this hiring restriction to see when there would be consideration to allow that position to be brought in.
Correct.
And the timing of that is?
So it looks like she'll be graduating in July. So we're looking at probably a couple months out from there. So we're looking at September.
Okay. Okay.
Which kind of coincides with.
Just please consider making it an exception.
Please.
September
We
1st.
also have no one in our billing department and that will be bad. So just a heads up on that piece.
Okay, thank you.
The second thing is, I did write a proposal to OMH regarding mobile crisis funding. I don't know, you probably don't remember, but it was initially funded by ARPA, funds to start the daytime mobile crisis team. We then.
Is that where the city gave 80,000?
Correct.
Okay.
And then we were able to secure some of the BJA grant funds that we didn't spend mobile crisis, it fit that. So we were able to use funding through the end of September for this year. We are doing Medicaid billing for that program, but it does not cover the cost of the program like we initially intended it to. So me and Carol devised a proposal in a budget, and we asked for $138,000 from OMH to offset Medicaid billing and all the other expenses, including salaries for that program. And they actually said, yes, you can have the full amount. And it will be in our state aid letter for whatever the difference is of funding for the last quarter of this year, and it will be annually in our state aid letter going forward.
That's great
Yeah,
news.
and it gives you, what does the team look like?
So we rotate 3 therapists through the program, and then we have one consistent case manager through. So we have a mobile crisis case manager position filled, and then we rotate 3 therapists. 2 do 2 days a week and 1 does 1 day a week.
So as you go out of the clinic and you respond, you always have an MSW and a care manager.
Yep, because of the billing requirements, you have to have a licensed provider.
Okay.
Yep,
So they're your mobile team.
correct.
Wow, that's
So that program should be whole with all the expenses. We included in, mileage and other things because of the car, other expenses for the program. And they said, they reviewed it with their budget team and said, yes, they're going to give that to us annually.
That's some great
So
sustainability.
you get this annually for how long?
They said annually, so it would be in our state aid letter just with our other annual state aid. So it goes on for indefinitely at this point.
That's great.
Chris Petras would say, in perpetuity.
Yeah.
Remember?
Yeah.
So in this daytime mobile crisis, because Liberty Resources still does till midnight.
Correct, and that's regional state aid that comes through the entire region, and they provide mobile crisis for multiple counties.
Oh,
So,
Well, that's great. And it has deferred police response or ER response
oh
or,
yeah, I would say, I could go back and look at the data, but it's a very, very high percentage of people end up not needing to go to the ER. And that we relieve law enforcement. They can, most of the time, we know in the first 5 minutes that they don't have to stay, they can go on other calls. And also if police bring someone to the ER, they usually have to stay
right?
for a while. So it's taking resources, that could be helping in another way. So
Great.
that's all I got.
Thank you very much. Brenda Wyman from Office of Aging. We have, well, actually Deborah is here. I'm sorry. I switched the agenda up on you. So I had you up first because you have no resolutions and
Okay,
didn't have an update. So if you'd like to
Yeah.
get us up to date.
So a brief update,
Okay.
apologize for being a couple minutes late. A lot of the programs that we fund for the Youth Bureau have already gotten started. And they're kind of starting to put out some of their calendars, like the Brutus Summer Recreation Program is a nice couple-week program going on. The Hideout has a really nice camp. We've been working, with the United Way and Chad to kind of try to put some ideas together, and things keep popping up, which is nice. Passport to History just wrapped up with the Auburn City School District. They did 4th graders. They toured around the city and learned a lot about the different history in the community. That program went really well. So there's just, some are wrapping up and some are kind of just getting started that we do. There's a new monitoring tool that the state is asking us to start using when I go out and monitor the program. So I'll be trying to, I will be implementing that when I do the site visits this summer. There's just a lot more detail to it. So there'll just be a little bit of used to some of the questions that they're asking just to make sure everything's being done correctly. Again, hopefully we'll know soon how much funding we get for 2026. I hope to have those applications out in the next couple of months. I think based on the budget and what we've been hearing, we'll get more funding, which will be great for not only the programs in the community, but to offset the administrative component of the Youth Bureau as well. So that's all I really have now. Do you have any questions?
Did anybody have questions? Great.
And there's also a couple new programs that kind of come to find out about that we could reach out to for next year for funding too, who haven't received funding before. So it's nice to kind of get some new programs and new organizations involved. So I'll have a few of those on our.
And I know this comes, out of your stop DWI assignment, but it's quite related to youth as well. But maybe you want to reinforce the date, the time
Oh, for the
of Falcon Park. the
baseball game.
ball game,
Yep.
Yeah.
So SAP DWI Day at Falcon Park is Sunday, June 22nd. It's a double header. There'll be 2 games that day. Kids under 18 are free. That kind of does coincide with, fortunately, we have a lot of funding in the community to do these nice things. So the Give Grant also is doing a free entry game the day before on Saturday at Falcon Park as well. So maybe just look at your calendar and see what weather day is better around here. I'm sure one of them will work out, but hopefully we'll get a lot of people out to get some information on SAP TWI and other programs we have in the community.
Great, thank you. Thank you. So we'll go back to Brenda Wyman with the Office for Aging. Let's start with your resolutions. The packet resolution HH8 and HH9.
So these are both providers that we already work with, but we're adding some funding that we have to increase our aid service, working with these two. That's really all. They were just kind of routine.
Mhm. Were there any questions on these two resolutions? I would like to bundle them. One is contracting with Access to Home for Age Services. So it's related to benefits for those who can have, was explained, like
Any
the
ISEP
kinds of
program,
aid
right?
that might be cleaning dishes and.
In the home bathing.
Yeah. Exactly.
And why do you have this if you've already done it? I'm confused.
So the access to home needed to cover the the January to December, including the ISIP and the unmet need money. The previous, we only had a good 3 other funding streams, so.
So you've done business with them.
Yep.
But you're adding a funding stream?
Yeah, so, it just gets more and more complicated for us to
Uh-huh.
pay for the services, and so we're pulling from all different funding streams. So this is to,
Allow for
Allow
additional
us.
money to come into this program from,
yes,
okay, so you can provide more aid service if you tap into this new funding, okay. Because you have,
our unmet need funding ended up going up last year more than we expected. And so when we had done the contracts, we hadn't expected to have the funds to do this.
before you got the cars and the contract aids, you were leaving a lot of ISEP funds on the table. Is that
I mean,
still
that
the
was very
case?
COVID related.
Okay,
We had a real slowdown during COVID, but now, no, we're definitely seeing an increase. We're getting called all the time.
and you're using the allocation that you have.
Yes.
That's good.
And HH9 is contracting with Turner's Helping Seniors LLC. And this is a program, the Helping Seniors is what I understand, it's respite
Yeah, it's,
for caregivers.
yeah, this one is a little bit more home care oriented, respite oriented. Mhm.
Okay. Anybody have questions about HH8, HH9?
I'm just nosy about 9. Is Turner's Helping Seniors a new vendor or it's just a rename?
Yes.
It's a
Name
rename?
issue.
Okay.
Who had they been?
Seniors Helping Seniors, I think our contract had normally been with Seniors Helping Seniors, but it's Turner's Helping Seniors Limited Liability is the true name.
Okay. Can I have a motion to bundle HH8 and HH9?
Move it.
Thank you.
I'll second.
Any questions? Discussion? Hearing none. All in favor of HH8, HH9 as a bundle?
Aye.
Aye. Any opposed? Thank you.
And that is one of the things that I have on my report is that we are seeing an increase in older adults needing home care, caregivers under a lot of stress. In the last 5 months, we've added 9 new people to our ISIP program, which is a pretty rapid amount. And we just had another one that was getting added today. So that caseload is growing. And then we are also involved, as of Friday afternoon, we got an urgent call from a caregiver. One of her parents has dementia, and the spouse They just couldn't manage the situation any longer. Our caseworker spent the afternoon arranging emergency respite. We have a contract with Loretto and arranging for the PRI to be done and the assessment to be done, for the person to be able to get into the nursing home for a short-term stay so the family could figure out what to do next. So to give them a break. So the respite started today. It's an 8-day respite will be provided to this family, inpatient, full 8 days. So hopefully that now we could continue to work with them and
Take some
come
stress
some
off.
long range plan, take the stress off, you know. Yep. Yeah. And it's just been a lot of those kind of calls recently. People just finding it harder to manage without some help. Our biggest challenge is a lot of our service is only 2 to 4 to 6 hours a week, which is very, very
Very
minimal.
minimal.
Their caregiving.
Having been a caregiver.
Yeah.
Yeah, that would
That's
almost be insignificant.
yes.
For-
Barely enough time to
Yep.
get away for a little bit. Mhm. Yeah, so our population is definitely aging.
You have a negotiated rate with the nursing home on what you would
We
pay
go,
for
we,
that?
we still go by the Medicaid rate.
So they'll take the Medicaid rate and
Yeah, it's great.
glad they have some capacity.
Thank goodness
Mhm.
they've been able to help us out and in this particular situation, accommodate us on the dementia unit. So that was especially helpful. Yep. I do want to mention that the farmers market coupons are starting in just a few weeks and we always have to update our website, update our phone message. Dan is always really good about doing that for us because we just get unending calls. When the coupon's going to be out? When the coupon's going to be out? So got that all set up. Brian Soper has offered again to help us set up with cones. That lets us do 2 rows of cars at a time. It's quite an event out at the mall, but it goes pretty smoothly. We're pretty well-oiled machine. We do have more coupons than ever this year. We think it's a one-time thing with some COVID money being used up at the state level. Yeah. So we probably will end up doing a second, we've scheduled a second at the end of the season out at the mall again to try to make sure we've given out all those coupons.
Do you have to do an income-based qualification?
It is income-based and individuals attest on a form that
Okay.
those qualifications.
Okay.
Yep, and we post that, we'll put that in all our literature about it. I don't know off the top of my head, but it tends to be the same income levels like it is for HEAP. So people who qualify for HEAP will have to qualify for this.
Okay.
And people can get this as well as the veterans. And if there's a household with somebody who qualifies for WIC, the WIC, and all of those. So, and then I just want to thank you all for hosting, letting us honor those seniors last couple weeks ago. That was really special and meant a lot to them. And I've got some great pictures that I've got to share yet. And then Jonathan came out to our volunteer recognition lunch on Friday, this past Friday. We had 80 people there and they really appreciated. Most of them just had such positive comments and it's the only time we get all the staff that are involved in the meal program, all the volunteers that are involved. Some volunteers that only volunteer 1 day a week, so they never meet the volunteers that volunteer the other 4 days of the week and the substitutes. And it's just a really nice time to get everybody together and they make connections and it's they do so much for us. It's the least we can do for them. So
Yeah, the money that they actually.
Yeah.
The dollar by dollar, hour by hour calculation of money that they're saving us, that they actually.
20,000 a year.
Yeah. I remember when I read the proclamation last year, just being amazed by that and wanting to reemphasize that with them. And what I noticed at the event, as I do every year, is that when they're at the tables, they love telling their stories and they all have like amazing stories about things that have happened, snowstorms where they have trugged up driveways. And so they start swapping stories and that's, I think, a really good thing for them to share.
It is. It's a really nice day, really special time.
Mhm. Any questions? Thank you very much. Steam. Okay, let's start with your resolutions. We are gonna pull resolution H6.
Because we have to come back next month with the same resolution, but creating help positions. We've been working with Diane Harris from HR, civil service, and we're gonna have the caseworker positions we need in the help program so they can be non-competitive and the applicants don't have to take a test at all. So they have to qualify and they fill out the application and qualify. But now we have to have them take a test. That'll be something that we don't have to do, which I think will be one more step to making it a little bit easier for folks who want to apply.
So, Christine, so they just applied, there's no, civil service test?
There will not be, right? Once that process, that Diane is working through to get those approved through the state happens and we, do the creation of the positions under help with the resolutions, then yeah, they won't have to.
Okay.
Do they apply to civil service? They just don't have to be scheduled for an exam. They just have to prove they have the degree and meet the
Yep, they
minimum
can meet the
quals.
qualifications and fill out the application and then they get approved through that process and then are on the list for us to interview. That's nice.
Christine, do they just need a 4-year degree of any
Need
sort?
a 4-year degree.
Any, like they can have it in criminal justice, liberal arts, or just?
There's some, it's on the website that what they need to have for a degree.
Okay,
Pretty broad though, right?
Yep, it's pretty broad.
all right.
Yep.
So, just to reiterate, it's being pulled because the language of HH6 right now is not create, which when we move these through the help program, it's actually, creating because of help. We've gone through this for a couple of years. So instead of,
I'm sorry, I don't understand. So explain it to me again, please.
when these positions that have to be created because the language is different in their in the
So the title, the caseworker title right now, excuse me, is competitive, is a competitive position. These, by going into this help program, which is a state program, they're non-competitive. So HR, civil service has to work with the state to have it approved, but then we have to create different, these titles within Cayuga County for caseworkers that are help designated non-competitive positions.
So we have to pull this because it's not written correctly?
correct. And it would have to come back next time anyway.
Okay.
Right, for the same,
Right, for the same.
for the same
Right,
vacancies.
and because the create language is there, it does not mean that there's any actual creation of a position. There's no new positions being added to the budget or the department. It's because it is a new title to cover positions that are currently open.
Are you asking because if we're all in support of that, can it just be amended and go to ways?
Exactly.
Would that be helpful?
I did think about
Is
that.
John on?
That's where I was,
John, can you hear me?
I do have Fred here. He might know a little.
Yeah.
I think what you're saying is this position needs to be reclassified and approved by the state. So
Oh,
while they're
first?
doing the same thing, they're similar but different. So until they're reclassified and approved by the state, there's no point in moving forward with the existing vacancies,
Right.
something like that.
So I think that she has been working to classify 5.
Okay.
And Jen had talking about that this morning. She was she
Sorry,
there?
I'm on. Yeah. So the Civil Service Commission has classified 5 caseworker help program positions, but we will then need to create them. The legislature will need to create them in order for us to fill them. So we have right now 7 openings for caseworkers. 5 of them have already been approved as caseworker that you've already passed. So we'll have to convert those resolutions by adding another resolution to create the positions, unfund the ones that are already the caseworkers, and then fund the caseworker help positions. So it's just a little bit more longer process. It's not going to stop us from hiring people. We can hire them provisionally utilizing the ones that we already have, but there's no point in putting these two in to only have to convert them next month. Does that make sense?
And no no urgency?
No.
No, because we already have,
Okay, yep,
Yeah,
yep, you already got 5
For
in,
5.
right.
yep.
Okay, so I just wanted to, before you went through your resolutions, let folks know that we're pulling HH6.
Ready for HH3. So we have a resolution asking to fill 3 clerk seasonal positions within the HEAP unit of DSS. We talked about these positions at the Personnel Committee a couple of weeks ago, and what we came to was putting in a resolution for 3. Last year we had 4. This is a drop down of 1. Just to give you a little bit of background on the HEAP program and the HEAP season that we have, about 6,500 households in Cayuga County receive benefits each season. The work that has to be done on those cases can be multiple touches for each season because there's different benefits that folks are entitled to and eligible for and can apply for. So 6,500 households, it could be, most of those would have 2 different application processes they go through with the HEAP team in our county. And just kind of for some perspective, 65 households is about 20% of the households in Cayuga County. I had looked up the census from 2023, I believe, and it said that there were 31,000, a little bit more than 31,000 households. So it's a big percentage of folks that receive this benefit in the county. And there's just continuing work that has to be done every year on these cases. It's not something that someone's eligible for and then it just keeps on going. There is paperwork that needs to be done. There's processing that needs to happen. People move, people receive their fuel from different vendors. So we need to make sure there's matches of the right vendor for a household before we push out the HEAP payments. So it is what I would consider like kind of a high touch program as far as communication with clients and the paperwork that has to be processed. So these 3 seasonal workers work 24 weeks. They work full-time, the 35 hours for those 24 weeks. Last year, they were with our team, the entire team of HEAP actually last year was at the CAP building. Right now, we're trying to figure out where they will be, where we're going to have them in the county office, where the county offices are at 63 Tennessee Street. There's a possibility if we are eligible, I guess not eligible, if we're able to have a contract for an alternate certifier, which is typically been CAP, that we would be able to have them be back at CAP again. But kind of an update on that process. I am meeting with the purchasing director on Friday to discuss an RFP process for the HEAP alternate certifier program this year. And we will see how that unfolds. Looking internally as well at some changes around how we process HEAP, because we are going to be going from 4 to 3 if this resolution is successful. We need to change some things up even in-house with how we process, bring in some of our clerical staff, bring in the examiners that have regular temporary assistance cases. So just trying to retool it and see what we can do to make things more efficient. And, try to get the work done with less resources, basically.
This is a fully reimbursed federal funded program.
It used to be.
So
Yeah,
it is.
that's why we got it, right?
Yes, it used to be,
Right.
and the program was expanded. I mean, there's a lot more people that receive it than did in the past, but basically the HEAP allocation that we received for the 2024-2025 season, which is in October to April season, was $188,000, a little bit, almost $189,000. We kind of the simple version of it is we utilized that allocation to cover what we had at CAP. We're doing pretty much everybody that applies for HEAP in the county was being processed through that CAP alternate certifier team. And so that HEAP allocation really covered them. And then there was a little bit left over, which was about $42,000 that we use to claim against the staff that we have in-house working out of DSS. So when you tally all that up, there is still a local share for the HEAP program, the administrative component. The HEAP program benefits are covered. Like we don't pay for those, but the administrative part of running the HEAP program, there is a local share.
Okay.
Does that make sense?
Yep.
We don't know yet what the HEAP allocation is going to be for the 2025, 2026. I'm hoping that it's at least the same. Okay.
Can I have a motion for HH3?
I'll move it.
Second.
I had one more point of for discussion. The 24 weeks at full time and with the title seasonal worker, this does not put these workers at qualification for unemployment, does it?
Yes, it does.
It does. So we're bringing back the same people generally?
In general, we do, but that just kind of depends on people's own circumstances and if they want to come back. And then if we feel that they're, able to manage the work. So we do an assessment of who we have, who's interested. We brought back people that have worked for the county before and have good knowledge of our computer system and somewhat of the HEAP program, temporary assistance. And, there are other folks that have been trained kind of from the start and have come back year after year.
Okay. So.
But it's not the 24 weeks, like being at the 6 month that matters for the unemployment. And they would, even if we cut that back, they would still be eligible for unemployment. I don't know if that's what you were getting at.
Yeah, I'm just curious, there are other seasonal workers who take seasonal positions, noting that it's temporary by contract. And as a result, they don't qualify for unemployment during the off season.
I don't know anything about
Sorry.
that. I know that these are folks that they have qualified for unemployment benefits. What the program specifications are for someone receiving unemployment, I'm not that well, knowledge, my knowledge base is like minimal, but my understanding is even if we carve back the 24 to a different number, they would still be eligible.
Yeah, there is some threshold, but I'm not sure what it is.
Like they have to work like I don't want to say for sure, but it's like something about quarters of the year and working, different within different quarters of the year and have to work 2 different quarters and something like that.
I don't know anything about it either, but
I do think they are eligible.
okay. Any other questions, discussion? Hearing none, all in favor of HH3?
Aye.
Aye. Any opposed? HH3 is carried.
Okay, HH4 is for us, DSS to accept the Summer Youth Employment Program funding and amend the 2025 budget. So we just recently found out that we received an allocation in the amount of $230,591 from New York State for this SYEP program. And this is the Summer Youth Employment Program, not to be confused with the Youth Employment Program, which we also have because of the GIVE grant that that Cayuga County qualifies for. So this is the summer program that we have had an allocation for year after year for a very long time. Our intention is to contract with Kelly King's department. If you have any questions, your employment training. We anticipate that the allocation would help 65 to 75 youth receive employment for 25 to 30 hours per week at minimum wage. So pretty good.
Put this on the floor. I have a motion for HH4.
Move it.
Second?
I just want to run by Kelly, so you feel you've got capacity and, obviously you have connections and expertise in youth employment. What is the number, what typically, how many youth could we serve with this kind of money coming?
So Kelly, I asked her that today. She said 65 to 75 youth would be served.
Okay. And that puts you at a level of being pretty busy finding sites and
So we've been doing Sound Youth for over 25 years.
Yes.
We have established work sites right now. We probably have 30 work sites, and within some of them, for example, Auburn and Varsity School, happen within the one work site. So in theory, we may have 40 plus different work sites for our youth. No problem placing kids, not a problem getting 65 to 75 kids either. And what's nice about this money is that we have from May to September to spend it. So let's say that, they're 14 to 20 years old. Sometimes they don't work out, sometimes they don't grow up. We have the ability to extend it longer than 6 weeks to fund money out. We've never given money back. So we did receive like $20,000 more this year. We're getting the 230,000. Last year, it was about 20,000 less than that, but we spent it all. We served 58 kids last year. So 65 to 75 would be
Okay,
sufficient.
great. Thank you. Any other questions? HH4? Hearing none, all in favor? Aye. Any opposed? HH4 carries.
HA5 is for DSS to enter into a contract with Access to Home Care Services, Inc. for the provision of personal care services.
HH5, can I, a motion to put it on?
All five.
I'll second.
Okay.
So this PCA program provides housekeeping, meal preparation, bathing, toileting, and grooming support to Medicaid eligible residents who are deemed eligible in need of the service. We are required to contract with home care agencies to provide these services for folks in the community, and it is 100% covered by state Medicaid funds.
So it's a contract with access to home.
Yep, for access to home care.
You're familiar with their services? It's something that's,
Yeah, they're a well-established community provider.
And this is a state set rate.
Yeah, so
This is a state set rate. It doesn't come through your budget.
Right,
It just
we don't
allows them to
negotiate a
do
rate.
business here in the county.
Yeah, we don't negotiate rates. There's a schedule of billing rates
Yeah.
that they utilize that are approved by the state.
I'll move that. Do we get a
I
motion?
think we have it on the floor.
did that.
Yeah,
Yeah,
we have
sorry,
it on the
Tom.
floor. Any other questions then or discussion? Hearing none, all in favor of HH5?
Aye.
Aye. Any opposed? Carries. We are going to move over and pull HH6. HH7?
Okay, HH7 is for looking to fill a head social welfare examiner vacancy that we have in the temporary assistance area, medical units of the Department of Social Services.
Okay, motion to put HH7 on the floor.
Do it. Second.
Good.
Just some background on this, we have this head social welfare examiner is the director level position that's over all of our temporary assistance program areas, including it's really 5 different benefits areas, including temporary assistance, SNAP, Medicaid, HEAP, and daycare. There are 55 employees in the various different levels within that temporary assistance and Medicaid area. They have 5 principals, 8 senior social welfare examiners, and 30 human services examiners, plus 12 support staff. So these are all the programs that are under New York State's Office of Temporary and Disability Assistance, and also some programs under the Office of Children and Family Services. Definitely a high-level management position that really is looking at all of the different requirements that come in, any sort of changes to the regulations of what has to be done for eligibility determinations, determination of eligibility levels, supervision of staff, management of personnel issues that come up that can be handled at that level before they really get up to my level at the commissioner's office. Definitely a leadership management position.
And this has been approved and gone through the personnel committee process. And funding is in the 2025 budget.
Correct.
I mean, what we did do at the Personnel Committee was remove at this point in time the backfill language because there will be promotions. And then if all the backfills went, there'd be a new entry-level county employee. And we'll be considering how to handle that after the September 1st deadline.
Any more questions or discussion? Hearing none. All in favor of HH7? Any opposed? HH7 carries. Thank you. So let's,
Can I just do a little bit of an update?
yeah.
On a few things? I do have some good news. What? Yes. So talking about emergency housing numbers, our census has dropped. Pretty, I can say that I consider it to be something worth talking about.
Yeah.
Our census of singles has dropped to 89, which we've been in 100, 110, 115. So that our singles have dropped and our families have dropped. So I looked at Jen's, she had given me some data. I don't know, maybe I'll find it in here, but it was, it was quite a bit of difference, like from May to June, here it was. So as of 5/16, we had a census of 98 singles and we're down to 89 singles. We had 33 families and we're down to 27 families. So that's a pretty big deal. And I think that some of it is attributed to that we are in the warmer weather, but we were in May too. So, it's been going down a little bit over time. I think that we have seen more success in transitional housing, being able to move people into permanent housing. So I think that it's starting to sort of take hold. Some of these programs, the Cayuga Health Network program has been successful with some folks. And that's a great thing. I mean, I think that's what we want to see happen is for them to get into a transitional apartment, be there for a little bit, get some support, kind of, work through some issues if there are any that need to be done with helping a landlord feel that this is a good client, to take in, as a tenant. And yeah, so hopefully we're seeing some payoff in that. We also have seen some success with the rental supplement program. As of today, when we talked to the temporary assistance director in charge of that, there were 11 households that were receiving rental supplement. So if you remember what I talked about with that was they don't have a income that is going to be able to sustain getting a market, market value, apartment, that high rent. We supplement their rent so that they are able to move out of the emergency housing and get into this permanent housing while we continue to supplement their rent with this program funding that we have. So
Can you supplement for quite a while?
yeah, it can go on.
Mm-hmm.
Rental arrears program, that was the SAFE program that we've had a resolution in for. We have utilized all but $80 of the money that we got as an allocation, and we're going to get more money again in October. I believe that will come through, and so we'll be able to do that to prevent folks from being evicted from their homes, to prevent them from coming into or needing emergency housing. So I think that these are positive, really positive steps.
I got a question. Qualifies for emergency housing?
Quality.
Like anybody is just, or do they have to meet an income threshold? Because I just couldn't imagine like somebody may have a job on 1 month and then next month they don't have one. But if you look at the cumulative time, they probably don't qualify for any assistance.
So there's a whole guidebook and there's a lot of regulations around who is eligible and what resources they're allowed to have as far as, income coming in, income in the bank, housing resources, what they have for savings account, gifts they get from people. There's a.
Okay, there's a form, yeah, so like somebody wouldn't automatically be,
No, there's a rigorous.
say, for example.
No money.
No,
But somebody worked at Newcore and then next month they did not, they could possibly qualify, correct?
depends on what they have for resources. Yeah, I mean, it depends on their personal circumstances and there's a rigorous process to screen them for eligibility.
Okay.
That's what our whole eligibility team, that our temporary assistance workers do. There's a lot that folks have to hand in as far as paperwork. We have a lot of access to a lot of data to see if they have resources through employers. We have It's a really rigorous
No, I
process.
just want to make sure people
Yep.
qualify that would have been.
There's some updates in one of the Auburn Housing Authority. Like certain 20-some units have been out of service, they're all being rehabbed and
Yep.
at Olympia Terrace or, I mean,
Mhm.
that,
Yeah.
when they get opened
Yeah.
again, there might be some resources for families as well, right?
Yeah. Yes, that's true. Yeah, then there are some things coming on the horizon, I think, for different, permanent housing opportunities. Some of them are gonna take a while to come to
Mhm.
fruition,
Yeah.
but, for now,
That's
we're
great.
continuing
Take
to
the good
go ahead.
news.
I'm taking and run with it. The only other thing that I wanted to say briefly is most of the people that we have planned for to be at 63 Genesee Street are in, except with the exception of our intake unit. So the temporary assistance intake unit is in the front door for services for temporary assistance, and that is still operating out of the old post office. That's where they've been for, the past year. We are working our way towards having that phase of our move-in take place. There's still some things that we're working and chipping away at, not me, but personally, but the landlord, Shireen Andresco, has been tenacious with making sure that some things are being addressed that we need to be able to safely open to the public and have the public interface happen there.
And we've delayed the public.
Manage the kind of flow of paper. And it's a lot, and it's happening now at the site at the old post office, but we just want to make sure that we have everything ready in the facilities, to manage and take care of, everyone's needs. So
How many more will come into 63 then when the intake unit when we're ready for the intake
how many
unit?
more?
Yes,
What's the intake team's number?
exactly.
Well, I don't know exactly what the number is, but there's got to be another like 20. John, maybe John knows the exact number, but it's got to be like around 20 that are going to be coming in. That doesn't mean that everybody that works at DSS is then going to be at 63. That had been talked about in the past. We still have, even after the intake team moves into 63 Genesee Street, we will still have folks that are not working out of that building. We're going to still have case integrity working out of the highway department, and our child support unit is actually going to move into the old post office area where the intake team is now, in order to have a site that meets their requirements for how they need to set up shop to be a child support unit that has federal information. It's this, all of the federal regulations around securing and having a certain kind of site will be met over there that we couldn't manage for them over at 63 with the space that we have and the configuration that's there. And then on top of that, we also will still have some staff out of certain program areas that are working remotely, and a good number of staff that are still going to be kind of a hybrid of working out of the office and then having flex space that they can kind of land in as they need to be in the office. So.
And I'm sure if you've not seen 63 Genesee Street yet, that you would be open to calls for
Yep.
anytime, stop over.
Yeah.
I'm there, Jim's there. So we're operating out of there. Security is there right now too. Contracted security team has been there. And they're, you know, they'll let you in. Come tell, have your badge.
Yeah. Okay.
Just for me today? Thank you.
Thanks for the good news.
Mhm.
Yes. I think there's actually some other good news, and that would be about the court issue with housing bid.
The court issue, oh, I don't know. I'm not sure. I don't know if I'm aware of that.
That the court challenge that was under in challenge has been
It's
prevailed.
They prevail. Oh my gosh, that is great news.
Decisions prevail.
That's great news.
So,
And
you know, that
so,
group of neighbors that was using an attorney and taking this to court, the court prevailed on the side of Visions and
Okay.
the city.
That's great news.
I had heard they had the application ready to submit on the 12th.
The AT funding, I've been working with
Yep.
Crystal on that and yeah, give her some data that she needed and then some a letter that came from the county with
Yep.
information that was needed. So that's awesome. That's great news.
Okay, Kathleen. Behind you are. Kathleen, you have 2 resolutions to read. Let's take a look at those before you go into the report. HH1 is a contract with Core Nurse for RN services. This is with the EI programs.
Yes, our preschool, we have a student who'll be going to preschool as a 4-year-old who needs to have a nurse accompanying this child. And we did have a contract in the past with Nurse Corps. At that time, we were not able to provide service to that particular child because we could not find a nurse for those circumstances. This is a different circumstance. I think might be a simpler circumstance to be able to find a nurse to accompany 6 hours a day this child in preschool.
May I have a motion for HH1?
I'll move.
Thank you.
I'll second.
It's certainly no inexpensive proposition. It's $71 an hour
Yeah, so $431.70 a day.
a day.
That is our responsibility for this mandatory program,
Right. And you'll
And
get,
that's preschool level.
preschool level.
And the child, it would be
This child is a
last
4-year-old.
year preschool or?
Yes, so we expect it would be a calendar year. We expect this child will start in September and continue most likely through summer program next year before entering kindergarten.
What's the kindergarten, the school district takes over?
Correct.
Do we have any other cases like this?
At this point in time, we do not have any cases currently that require the supplemental assistance.
in your department will get whatever 59% reimbursement on these costs like you would for other program costs.
Correct.
But 50% will be borne by your,
And account.
the county's 3 to 5 program.
And it's a mandated service. We can't walk away from it.
Yep.
That's correct.
Anybody have questions, discussion?
When does it start? Like,
September, we're
and
looking.
it will go all the way to next September?
Yes,
So through the summertime as well?
the summertime. It's a little shorter duration. Summer session is usually 6 or 8 weeks. But
Any other questions? Hearing none, all in favor of HH1?
Aye.
Aye. Any opposed? HH1 carries. HH2, I believe, is also a contract issue or accepting funds, so happy news.
this is funding for our public health preparedness contract. We've had this for about 20 years now. It helps offset some staff funding. It helps offset some contract funding And these are services that where public health emergency preparedness is a mandatory service. So it's a beneficial contract to help offset some of our required work. So we'd like to accept it. We're waiting to see on this one regarding federal funding, down the line. We heard that this could be changed, but at this point in time, the state's ready to start the contract with us. So
A motion to put this HH2 on the floor? Thank you.
I'll second unless Tom wants to.
Okay, thank you.
That's it.
Any other discussion or questions after Kathleen's description? No. Pretty standard. We've been doing it. We need to do it. Readiness, preparedness. Hearing none, all in favor?
Aye.
Aye. Any opposed? And HH2 is carried. And your report update.
yeah, I have a number of them. We had sent out a press release last week about hydrilla control beginning hydrilla treatment on Cayuga Lake. We just received an update today that it was delayed, the application of this herbicide on the hydrilla, and both the DEC and Army Corps will begin work on Cayuga Lake in the designated areas to fight hydrilla the week of June 23rd. We are working to send an updated press release tomorrow. We met yesterday, and when I say we, Ani Fish, our environmental health director, and I met with 4 engineers who are going to help support us in some of our required engineering work while we have a vacancy while Ani is on. They asked some really good questions. So fortunately, they come with a base knowledge and they had some really, you could tell that they were asking the right questions, and Ani was really pleased with how things went as well. Still working to find a baby specimen preparation. So I think I'd sent something out to all the legislators. Spread the word. Where, we'll do some follow-up with a few other options, but we're fortunate that our current provider is still serving us, but we know that that's very limited and we must find some new people, some new entities to provide this service. Related to preschool special ed, there is a new tuition-based center that opened in Camillus by the company called Milestones. We do have children in our county who will be attending summer program there, as well as we anticipate fall program. We're really glad that there's alternatives that are a little bit closer to home. In addition, Gaver Centers has 24 slots. But this one's a little bit closer than some of the other schools that are further out in Syracuse or Cortland or Ithaca. But it does present its challenges with transportation also. So we're working with our purchasing agent, Amanda O'Grady, to potentially do a mini RFP for this destination, for this school, depending on the children who are dedicated to going there. But our first round is always to try and get families to transport their own child, and we can compensate families to do that, which is certainly a much less expensive manner to bring your child to school.
Gavris has only limited slots for summer programming. That's why he has to, is that?
Gaver Center had not responded to these families and the schools in a timely manner. So these families took what was made available to them immediately. We have had some conversation with Gaver Center also. Their slots will likely fill up for summertime also.
Oh, I didn't realize families could go to whatever vendor or program they want.
Well, they can if they don't know there's an opening somewhere.
Gotcha.
Yeah. So we've had Megan Sidoris and I have had conversation with the Gaver Center, some of their administration, and we think that's going to they'll change their approach
Mhm.
to this as we move forward. Yeah, but there've been some staff turnover there, so I think things they weren't as familiar with what the expectations were.
Mhm.
In community health services, we were surveyed on May 27th, 2025 for our licensed home care service agency, surveyed by New York State Department of Health because we are regulated under Article 36 there. it's unique in the fact that we have not seen patients through our LICSA is the acronym, Licensed Home Care Service, since the beginning of COVID. We do have the opportunity, so to finish up the survey, it really went fine. You know, there were no patients for them to review. They did ding us on a policy that we didn't have, and they dinged us on the fact that we, on one of the years in 2023 had not done evaluations on our nursing staff, but that was the year we didn't have a community health services director, and I didn't know we needed to do that. So,
Is
I'll
this
take
the
that.
limited license that they,
this
the
is
lens that they put you through, not this
no,
expanded?
this is the full shebang.
Oh, okay.
Yep. So, we've sent back our response to the citations they had us, and we're waiting to hear back that they accepted it. I don't anticipate any issues. And it was really helpful because it was a good chance, again, to have another conversation about the pluses and minuses of maintaining our licensed home care agency. And I'm going to bring this up at our Board of Health to get their opinion about whether we should maintain this. I don't mind saying that I was very reluctant to be at the forefront of relinquishing our license initially because, you know, as Brenda keeps saying, as we hear, home care is such a dire need in our community. However, the services that our health department provides through the licensed agency is not the primary service really needed by many of our community members. We were doing primarily maternal and child health home visitation, and there are a couple home visitation programs, but not with nursing. They are with community health workers who will help, and we're still available, right? The nurses can still.
Plus, you still can do 6 visits without having this full license,
We
right?
relinquish this license, yes, we can do some home visits up to 6 times before they have to be admitted into a home care agency. So I'll be coming back more after we talk with the Board of Health and we get there. I really want their blessing on it before we move forward with it, with relinquishing that. So additionally, we're updating our measles response plan to affirm our staff vaccination status because measles is still a widespread concern within the United States, although we are seeing in the Southwest that some of the new cases are diminishing, which is good news. Our public health fellows were granted a stay. There was an injunction placed. I won't even use the correct terminology. We have no idea how long this injunction will be in place and how long they may be able to stay with us. But the state had said they're going to keep compensating the public health fellows while they're able to. So we have 2 fellows remaining with us. We're pleased out of the 4 that we had, correct. So we're pleased that they are willing, you know, to take that day to day, right? And still work with us because they're very helpful to getting our daily tasks accomplished. Regarding our building, we know that our planning office is helping facilitate looking at fixed assets, but you know, we had spoken about this earlier in the year and had some conversation. Deanna's really spearheading effort to make use of some one-time funding opportunities to provide ideally some updates to our office to become more accessible to the public. So she's got a meeting on the books at the end of the month to working with operations and IT and purchasing, and then assuming we have a buildings director at that time, that person as well, to discuss what we might be able to accomplish with the funding we have within the timeframes that we have. So I'm excited about that prospect. I wanted to give more information about some more fiscal, you know, some more of the federal changes that are forthcoming, but we really don't have a lot more to share at the moment. Our National Association of City and County Health Officials is doing some analysis of the fiscal year 26 proposals for funding that are out there. So I think probably in another week or so, we'll have more information to share about what is anticipated regarding public health impact with some of the funding that's out there. So those are most of my updates. And then I was going to ask if we could have an executive session so that I can speak regarding another matter that is good for you to be aware of.
Can I get a motion for executive session?
I'll second.
On the medical condition of certain individual.
Thank you.
Yeah.
I'd like to ask if Deanna Ryan and Fred Westfall could stay and be part of that conversation as well as the legislators.
Do we stay or go? Because we got people here.
We should.
There won't be a vote on this, it's an update.
There's no action anticipated. Yep.
Bob, don't worry. We're done anyway.
Yeah, we're done after this.
Yeah.
Brendan went, right?
Huh?
Yes.
Okay.
Thank you.
All right, make motions. Can we adjourn?
Can you hear me? Fred, can you hear me? Oh, are you there? Fred, can you hear me? You can. Can you call my cell? Thank you.